Welcome back to Good Morning San Diego. Those dealing with chronic pain could also be dealing with depression or another form of mental illness. Joining me to discuss this matter in greater detail is Jackson House President and CEO Bruce Figuered. Bruce, welcome back to Good Morning San Diego. Could you speak to what the Jackson House, what is its role in society? What do you guys do?
Sure, yeah. So Jackson House was founded in 2017, and so we operate residential mental health as well as addiction treatment centers, and we also have outpatient mental health and addiction treatment centers as well.
How many people are out there, I know this is impossible to put a number on, but people dealing with chronic pain, is that number bigger or smaller than we think?
I think it's a lot bigger, you know, and I think oftentimes it goes undiagnosed. People, you know, will have an injury and then they have some chronic pain that's associated with it, and they really, you know, it's chronic and persistent, and then there's, you know, maybe some level of acceptance of the fact, well, I'm just getting old, or like these things just happen as you get older, and they really don't really have much insight into the impact of that chronic pain on their mental health or their outlook on life in general.
Well, as we were talking off camera, I have a limited personal experience with this when I had a hip going south, and I wasn't diagnosed yet, and I was gobbling up pain medication left and right, thinking I'll just fight through this, work my way through this.
Yeah.
And it wasn't until I had surgery that people can't appreciate how that it's just a heavy weight when you're in with discomfort. It affects everything about your life. It's impossible to find joy. You can't sleep, blah, 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 and the list goes on. So I'm sympathetic to this, but is all chronic pain physical or is some of it mental?
Yeah, I think there's a little bit of both. And then there's also the impact of the use of opiates or painkillers too.
Which becomes a problem all to itself.
Yeah, I mean, so let's talk about that for a second. So when people have a chronic pain problem and they are on opiates for an extended period of time, your body becomes desensitized to it. So your body, you develop tolerance to those medications. And what research has shown is that they actually create their own pain. And so over time, if you're taking opiates for too long, the original pain that you had, you don't even know if that pain is still there or not because you've had to take increasing amounts of opiates that, you know, the end point of that could be deadly.
Right. So, and the reason why we're having this conversation is because it's sort of in the news. Now, I'm asking you to comment on something that you're 1,000 miles away from, 2,000 miles away from. But with the murder, the assassination of the Mr.
Brian Thompson.
Thank you.
Yeah.
The accused was also had a back injury and potentially had mental issues. I know we're taking a wild leap here.
Yeah.
But that's why this issue, I guess what I'm trying to say is that's why this issue is important.
Yeah, absolutely.
Addressing this,
it raises
society, right?
Yeah, so there's so many different things that are raised, you know, in this case specifically. You know, this is an individual who came from a very wealthy and affluent family. He had no history of mental illness. He had no history of drug addiction. He had no history of previous crimes. And then he has this back injury. He has surgery, and then he completely cuts himself off from all of society. His friends don't know where he is. His mother filed a missing persons report. And then during that time that he's cut off from society, he develops these sort of extreme ideas about that are anti-capitalist, profit, you know, in healthcare companies, and then this happens. So it is speculative to say like, okay, well, there's a mental illness behind it. We don't really know. And a lot of those facts will come to the fore, like over time, but it does raise a lot of points.
Again, and we're wandering into water that's probably over our head, so we'll leave that there. Yeah. But what can people do? So let's speak to the people out there who are dealing with chronic pain. What is the call to action?
Yeah, I mean, if you have chronic pain and you've been on opiates for a long period of time, I would recommend that you go and see a pain specialist and talk to that pain specialist about, you know, how you're managing your pain. And then also, if you are having chronic pain and then you have some sort of mental health symptoms, anxiety, depression, or other kinds of things, because it does impact many facets of your life, to give somebody a call and to reach out to get help.
And on that word of advice, we will call it a conversation. Thanks for rolling in.
Thank you so much.